Hi everyone, my name is Ryan Williamson, and today we're going to talk about an unspecified case of liver cirrhosis. Our case begins with a 55-year-old female presenting to the ER. Her symptoms include general malaise, loss of appetite, fatigue, diarrhea, nausea, vomiting, and abdominal pain since the first start of the week. She admits to intravenous drug use in years past, but claims she's been clean for the past several years. Upon physical examination, the physician finds that she's tender to palpation in the right upper quadrant. She has 2+ pitting edema in her lower extremities bilaterally. She also has jaundice with scleral icterus. These symptoms point to some issue with the liver, so a physician orders a liver function test and screens for hepatitis A, B, and C antibodies. The results come back with her alanine transferase levels increased, her albumin levels decreased, and a positive result for her anti-hepatitis C virus antibodies. He then goes and orders a nucleic acid test for her hepatitis C virus and also orders a ultrasound of the liver. The nucleic acid test returns and is positive for hepatitis C viral RNA, whereas the liver ultrasound shows severe cirrhosis of the liver. This gives him enough evidence to make the diagnosis of chronic hepatitis C infection, causing this cirrhosis of the liver. The hepatitis C virus itself is a 16 nanometer, spherical, enveloped, positive sense RNA virus. It's of the family Flaviviridae and has its own genus of Hepacivirus. It's around a 9.6 kilobase paired genome, which can encode a 3,000 amino acid precursor protein. Now, that precursor protein can be broken down into 10 structural and non-structural proteins that are involved in viral replication and parthenogenesis. The main goal of this virus is to infect hepatocytes and spread on to the next one. This diagram here shows the entire hepatitis C RNA genome. It breaks down structural and non-structural proteins, which we'll go into a little bit more in depth in the next slide. But as you can see here, the structural proteins are your core protein or nucleocapsid, your envelope proteins. Your P7 protein is technically a structural protein, but this diagram has it labeled otherwise. And then your non-structural proteins are involved in different aspects of RNA synthesis. The core protein is going to go on to form the nucleocapsid, so it directly binds to the viral RNA. E1 and E2 are the envelope proteins. E2 is involved in attachment, and E1 is involved in fusion. P7 is a transmembrane protein that is involved in shuttling viral proteins into the ER so they can be folded and packaged correctly. I won't go into all of the non-structural proteins listed here, but the two main ones are NS5A and NS5B. NS5A is a viral protein that is involved in transcription complexes, but is also in part involved in monitoring the cell's response to interferon. So it kind of gives the almost senses how well the cell is going to be able to fight against the virus. NS5B is an RNA polymerase, so that's going to actually synthesize the genetic material needed for this virus. Being an viral RNA polymerase, it has no proofreading mechanism, so that's going to lead to a very large increase in genetic diversity. With that increase in diversity comes at least 6 genotypes, some papers say 7, and around 50 subtypes of hepatitis C virus. And these genotypes are higher, specifically in different regions of the world. So type 1 is much higher in Western Europe and the United States. Type 3 is higher in Africa. Type 6 is much higher in the Pacific Islands and Asia. And these are all due to different pressures and environmental changes. Now, this is a blood-borne disease and blood-borne pathogen. So with that being said, needle sharing from IV drug use, sharps injuries in healthcare, maternal transmission, and sexual contact are all ways that one can get hepatitis C virus. There's going to be several increased populations that have increased risk populations. Some of these would be IV drug users, pre-1992 blood product recipients, so that's before they really ramped up the screening to test for viral infection, as well as non-sterile tattoo recipients. It's basically a polite way of saying prison inmates who get tattoos without sterile technique, and HIV-positive individuals who have a very immunocompromised system. The virus is very hardy and is viable on surfaces for up to 3 weeks. So if there's a blood spill or someone who you think has hepatitis C gets a cut, it's important to treat that and also to clean up with a bleach-based cleaning product. The infection can take an acute phase or chronic phase. Unfortunately, it is often asymptomatic for both. The acute is a short-term illness within 6 months of the infection, but only 20 to 30% of people show symptoms. Of those people who do show symptoms, these include fever, fatigue, dark urine, abdominal pain, nausea, vomiting, jaundice, and more. So in our case, we saw some jaundice, but we looked at, chances are this is a chronic case. So of these people who present with an acute infection, about 15 to 25% will clear it entirely, which means their body is able to fight off the virus. Unfortunately, the remaining 75 to 85% move on to chronic infection. Those with the chronic hepatitis C infection are typically asymptomatic for years. So in our case here, we see this woman said she used intravenous drugs, but had stopped for several years and now is showing with symptoms of liver cirrhosis and liver failure. That's because she most likely got exposed several years ago and slowly has been having her liver be attacked by this virus without her knowing. Diagnosis can be made via blood screens or presentation of subsequent liver disease, as is this case. 60 to 70% of chronic hepatitis C infected individuals will go on to chronic liver disease, whereas 5 to 20% will develop cirrhosis in a 20 to 30-year period. Unfortunately, 1 to 5% will die from this disease, either from extensive cirrhosis of the liver and liver failure, or liver cancer, which we call hepatocellular carcinoma. This diagram is from a review article I used for my paper, and it shows the flowchart of diagnostic techniques made for a confirmed hepatitis C infection. The first step, as we saw in this case, was doing an antibody screen for hepatitis C viral antibodies. If there's no antibodies present, then there's never an infection. There's not a current one going on. If there are anti-hepatitis C viral antibodies, then we know that this individual was infected and was exposed at some point, but we don't know if they're infected right now. So to confirm that, they need to do a nucleic acid test. Typically, this is a real-time PCR test to determine both the presence of viral RNA, but also the quantity of viral RNA. If this is negative, then the person had been infected previously and was either able to fight it off or it was a false positive. If it is positive, that means that this person is currently having an active hepatitis C viral infection. So, as in our case here, this woman has had a chronic infection, so these viral loads have been high for a long time. In addition to the serological testing, there's also several other diagnostic techniques that are going to happen. In our case, we saw a liver function test be run. Now, this is just a test that's going to examine different enzymes and proteins that are vital for the function of your liver. The big three here are alanine transaminase, aspartate aminotransferase, and alkaline phosphatase. So in a case of someone with liver failure and cirrhosis of the liver, we're going to see elevated alanine transaminase and alkaline phosphatase levels. These enzymes are typically inside the hepatocytes, but due to cellular rupture, they're out in the blood. We're also going to see a decrease in albumin levels in cirrhotic liver because typically healthy liver is able to make lots of albumin, but this liver is not healthy, so it can't make albumin, so the levels go down. Bilirubin is a compound that is from the breakdown of heme and red blood vessels and typically is processed in the liver, but if the liver is not healthy, it can't process that bilirubin, so the levels are going to go up as well. Several imaging techniques can be used to help the diagnosis of the liver disease that's going with this hepatitis C infection. In our case, we saw an ultrasound, but it could have very easily been a magnetic resonance image, an MRI, a CT scan, or an X-ray. As you can see here in our MRI in the bottom right, a cirrhotic liver has irregular borders. It's just atrophied. There's fluid buildup. It's not looking good. There's several treatment options for hepatitis C viral infection. Unfortunately, unlike hepatitis A and B, there's no vaccine. There is research ongoing. Several are in different stages of trials, but nothing's been approved. The main gold standard back in the day was interferon and ribavirin. Now, as we mentioned before, interferon is just a cytokine that is involved in turning on the cell's antiviral response. Ribavirin is a guanosine analog, so that's going to help stimulate and sustain that interferon response on the cell. In 2001, researchers switched to synthetic interferon with ribavirin. This had higher eradication rates for some genotypes. 75% was as high as it got, and that was 75 was around for genotype type 2 and type 3. Unfortunately, type 1 is what's most common in US and Western Europe. But regardless of the eradication, the side effects were just unbearable. They had severe flu-like symptoms, nausea, anemia, depression even. So this was going to be sustainable. They had to find some treatment that wouldn't make these patients feel so sick. In 2011, viral protease inhibitors were implemented. The two of name were tenofovir and boceprevir. Now, these had a much higher improved clearance for genotype type 1 infections for hepatitis C, but unfortunately they did not do anything to curb the negative side effects. So fast forward to 2013, the FDA approves sofosbuvir, which is a nucleotide analog that was modified so it could be absorbed in the GI tract, made it all the way up to the liver without being deactivated. So they had to do some fancy organic chemistry to make this work. But upon trials, they found that 90% of patients that were treated with sofosbuvir and ribavirin had complete viral clearance. They then combined it with another direct-acting antiviral drug, lenacapavir, and they found that 94% of these patients were completely cured. So they have found a sustainable cure for hepatitis C virus that's completely non-vaccine related. The downside with that is that it costs $94,000 with another $500 on top. So it's not a cheap medication. It's about $1,000 per pill, and only 13% of the 71 million people with hepatitis C virus in the world have access to that. Those numbers are much better than years past. These are from the World Health Organization, but still not anywhere near their goal of 80% by 2030. So prevention of this is key, considering 399,000 people die each year from hepatitis C viral infection. The main way to prevent spread of this is to stop intravenous drug use, to educate folks on safe, sharp disposal both in and out of the healthcare setting, to educate folks on safe sex, as is with any sexually transmitted disease. Public health education campaigns are important because folks need to understand how this virus is spread, how important it is, and the fact that, as you can see in our prevalence map on the right, it's not just in Africa or China or Brazil. It is everywhere. It's in the United States. It's in Canada. It's in Australia. It is a world problem. It's something that we need to fix. And now that we have the medication to do so, we need to make it actually attainable for the common person. So that's what we come down for advocating for lowering our prescription price. Until folks come together and let pharmaceutical companies know that we're not going to stand by this, we're not going to accept it, and get your politicians involved, everything. Change can only happen for good if we get a lot of people on board. So that's how we're going to hopefully be able to get this price lowered. In Egypt, they're already getting the knockoff versions coming out that are decent. They're working as effectively, and they're a little bit cheaper. So hopefully with continued competition, we'll see this price drop. So that's the end of my presentation on hepatitis C viral infection and the subsequent disease of liver cirrhosis. These are my references for my paper and my PowerPoint presentation. And then I would ask you guys if you had any questions, but we're submitting this online. So all I'll say is thank you so much for your time this semester, and I wish you all the best of luck for finals. Take care.